was a rescue, and he and his sibling were they both hit by cars? Just Buddy. Yeah, Buddy was hit by a car, and the vet told them that they needed to amputate the leg because it was too mangled, and the owners didn't want an imperfect dog. So they dumped him, and Phyllis was lucky enough and smart enough to go on the site and buy him from a rescue. And Buddy started coming to us because he was having some issues walking. I think his back was really hurting him, and you know, when you lose a leg, your gait is very funky. And so what I'm doing, and what we do a lot with our paralyzed dogs and our amputees, is really work on back mechanics and body mechanics. They tend to completely, especially the forelimb amputees, they're so much harder on me and on the dog than the hind limb amputees. But they tend to really throw their balance off, and what they do is, instead of having both their front legs like this, they do this, and so they put their forelimb in the center of their body, which completely torques the back. So I'll never forget, I think it was the first time we worked on Buddy, we did a massage. I don't even think we did exercises that day, and then we put him in the pool, and Phyllis called me the next day and she said his gait was the best it had ever been, and she was so shocked by that he walked so normally after just one session of physical therapy. But I always tell my clients of amputees that you need to do ongoing PT because these dogs are never going to be normal, and they're always going to have back issues and body issues and gait issues. And one of the things that I'm kind of hung up on, because I work with so many orthopedic dogs, is keeping their weight down, keeping them really slim, because it's just so hard. And I tell everybody, hop around for one day on one leg and see how tired you are, and then pick up a couple of bricks and try to do it. It's very, very hard. So what I'm doing right now is massaging the muscles on either side of his spine. His back is really tight and kind of tweaked out a little bit from running around like the crazy nut that he is. The thing that you have to be careful with if you're ever massaging your dog is you want to use the same amount of pressure that you would use on a baby or a really elderly person. You don't ever want to use the kind of deep pressure that we use on humans. It's just too much for a dog. So he's just got his back is a little bit tweaked out, and obviously because he's lost a forelimb, all the muscles along the sides of his chest and his neck are very tight because he's thrown this one right leg to the center. Well, the first time you massage a dog, I wouldn't make it more than about 15 or 20 minutes. And you can gradually work up. If it's a big dog, you can gradually work up to a half an hour. But when you first massage a dog who's never had a massage before, it's kind of like running a marathon. You release so much lactic acid into their muscles so they can be really stiff and sore the next day. And usually what will happen after that is 2 or 3 days later, they'll feel real flexible and really loose. But you have to be careful. You want to always underdo it as opposed to overdoing it. And you want to focus on the major muscle groups of the body. You never want to massage over a bony prominence. It just hurts. You know, it's like massaging over your elbow or something. It's super uncomfortable. So think of finding the muscle, the belly muscle, and just going right in the belly of every muscle. You'll often see with the dog, when you get to a spot where you've got a knot, their skin will go like this and kind of wiggle underneath you. There's a knot under there. That's why they're doing that. And what you want to do is just like use finger circles all along the spine. You'll find a little bump, and what you want to do is, okay, there's a knot, so you work on it for a few minutes and just kind of work on trying to flatten it out, and then you go somewhere else and then you come back to it, and you go somewhere else and you come back to it. You can't just sit there, be like, working on a wound. You can't do that. You have to do a little bit and move away, do a little bit and move away, and after 3 or 4 or sometimes even more times, it'll flatten out. So they're always going to be sore and compensating, so they're always going to have muscle tightness and muscle shortening and pain.
What are some signs to look for to recognize pain?
Reluctance to get up, slowness getting up, or a little bit of struggling getting up or lying down. You want to look for stiffness, especially in the morning or in cold weather. Sometimes dogs that are painful will seek out a cold, hard surface like concrete or tile because it feels good on arthritic and injured or overworked muscles. You want to work these chest muscles. They get very, very tight and very painful. You don't really want to work on the surgery site where the amputation was, because that can be a little bit uncomfortable. But I always get into the belly of these chest muscles here, and you want to think about like you're kneading dough, sort of stretching these chest muscles out. And then you always want to work going up along the sides of the neck. So that can feel really good for a guy who's overusing his forelimb. Dogs naturally weight bear 60% in their forelimbs and 40% in their hind limbs, so he's putting an awful lot of pressure on this one leg.